one of the studies that led to the use of routine cytotoxics in pancreas adenocarcinoma was this older study now from about 20 years ago, looking at gemcitabine compared to 5-FU, demonstrating a clearly superior outcome for gemcitabine. And that launched a whole series of trials comparing new drugs to gemcitabine and adding new drugs to gemcitabine. And I'm going to move to the key recent developments. This is the landmark study evaluating FOLFIRINOX. These data were initially presented in 2010. This trial evaluated FOLFIRINOX compared to single-agent gemcitabine in patients with good performance metastatic pancreas adenocarcinoma. And you'll see, again, there was a nice difference in outcome for patients who received FOLFIRINOX, a hazard ratio of 0.57, compelling p-value, and this has led to this being integrated as a standard of care, now essentially in every setting of pancreas adenocarcinoma. The other point of interest, I think, is an important one. We know that this disease induces a significant quality of life detriment for patients, but we also see in practice that when we treat this disease successfully and when patients respond, they undoubtedly feel better, they're eating better, putting on weight, more active, their pain is decreased. And this is captured here in this secondary analysis from that study, showing that despite the inherent relative toxicity of this regimen, if disease is responding and people are feeling better, their quality of life, as interpreted by the individual, is better for longer. The other major regimen in the advanced disease space is gemcitabine and nab-paclitaxel. This is the study that led to its FDA approval, comparison being single-agent gemcitabine. I'll make a note that compared to the FOLFIRINOX trial, this included a broader group of patients with performance status spanning from 70 to 100%, and it had no age limit in contrast to the FOLFIRINOX population. These are the outcomes: statistically significant improvement for gemcitabine and nab-paclitaxel, hazard ratio of 0.72, and compelling p-value.